What if I told you that the solution to your enlarged prostate isn't found in expensive medications with concerning side effects? What if the relief from constant nighttime bathroom trips, weak urine stream, and that constant feeling of pressure could be achieved in just 3 days using nothing but water, consumed in a very specific way? Today, I'm going to reveal a hydration protocol that has helped thousands of my patients reduce prostate swelling and regain control of their bladder function. This information is being suppressed by pharmaceutical companies because it's too simple, too effective, and completely free. It's time someone finally exposed the truth. Hello, I'm Dr. Grace Hill. If you're looking for reliable, no-nonsense solutions for prostate health and overall male wellness, subscribe to this channel right now so you never miss any content that could transform your quality of life. Today, we're discussing something revolutionary: how drinking water in a specific way can significantly reduce prostate swelling in as little as 72 hours. Before I reveal this remarkable water protocol, it's essential to understand why the prostate enlarges in the first place. What most doctors won't tell you is that benign prostatic hyperplasia, the medical term for an enlarged prostate, isn't simply an inevitable consequence of aging. It's the result of specific physiological processes that can be addressed and often reversed. By age 60, approximately 60% of men have some degree of prostate enlargement. By 75, that number jumps to 80%. But here's what few men realize. This enlargement isn't primarily driven by testosterone or other hormones, as commonly believed. The hidden truth is that inflammation is the primary driver of prostate enlargement in most men. This inflammation creates a cascade of effects: increased blood flow to the prostate, fluid retention within the gland, and gradual tissue expansion. Over time, this inflammation becomes chronic, leading to permanent enlargement if left unaddressed. 3 key factors contribute to this inflammatory response. First, dehydration concentrates urine and irritating substances that contact the prostate through the urinary tract. Second, irregular fluid consumption creates pressure fluctuations that stress the bladder and surrounding tissues, including the prostate. Third, certain dietary compounds create direct inflammatory responses in prostate tissue. What makes this a hidden truth is that standard medical treatment focuses on blocking hormonal pathways or relaxing muscles to manage symptoms, rather than addressing the underlying inflammatory processes. This approach treats the consequences rather than the cause of prostate enlargement. The good news is that proper hydration, when done correctly, directly targets this inflammatory cascade, creating rapid improvements that many men describe as life-changing. The water protocol I'm about to reveal works not by masking symptoms, but by addressing the root cause of prostate swelling. The connection between hydration and prostate health is one of medicine's most underappreciated relationships. To understand why proper water consumption is so critical, we need to examine the prostate's unique position in your body. The prostate gland surrounds your urethra, the tube carrying urine from your bladder. This means that every drop of fluid leaving your body passes through a channel surrounded by prostate tissue. When you're properly hydrated, urine is diluted, containing fewer irritating compounds. When you're dehydrated, these compounds become concentrated, directly irritating the prostate and triggering inflammation. Beyond simple dilution, water plays several crucial roles in prostate health. First, adequate hydration helps maintain proper blood viscosity. Thicker blood from chronic dehydration reduces oxygen delivery to tissues and slows the removal of inflammatory compounds from the prostate. Studies show that men with optimal hydration have up to 30% better prostate tissue oxygenation than chronically dehydrated men. Second, proper hydration regulates your body's production of antidiuretic hormone, ADH. When inconsistently hydrated, ADH levels fluctuate dramatically, causing the kidney to retain water at some times and release it rapidly at others. These fluctuations create pressure changes in the bladder that stress the prostate and surrounding structures. Third, and perhaps most significant, adequate water intake supports proper lymphatic function. The lymphatic system is crucial for removing excess fluid and inflammatory compounds from tissues, including the prostate. Without sufficient water intake, lymphatic flow becomes sluggish, allowing fluid and inflammatory compounds to accumulate in the prostate. What's particularly remarkable is how quickly the prostate responds to improved hydration. Unlike other interventions that may take weeks or months to show effects, proper hydration can reduce prostate swelling in as little as 72 hours. This rapid response occurs because the prostate tissue is highly vascular and responsive to changes in fluid balance and inflammatory status. Now I'll reveal the exact 3-day water protocol that has helped thousands of my patients reduce prostate swelling and regain normal urinary function. This method is precise, and each element has been carefully developed based on clinical experience and scientific research. Day 1 focuses on flushing accumulated inflammatory compounds from the prostate and establishing consistent hydration. Begin immediately upon waking with 16 ounces of room temperature water, not cold. Add the juice of 1/4 lemon and a pinch of unprocessed sea salt. The lemon provides citric acid, which helps prevent calcium crystal formation in urine, while the sea salt provides trace minerals that support proper cell function. After this initial morning drink, consume 4 ounces of water every 30 minutes throughout the day until 8 p.m. This regular interval is crucial. It maintains consistent blood viscosity and reduces ADH fluctuations. By day's end, you'll have consumed approximately 80 ounces of water, spaced evenly throughout the day. Day 2 introduces pulsed hydration, which enhances lymphatic flow around the prostate. Continue with the morning 16 ounces with lemon and salt, but adjust your daytime consumption to 6 ounces every 45 minutes. This creates a gentle pressure pulsation in your urinary system that helps mobilize fluid from swollen prostate tissue. On day 2, stop liquid consumption 3 hours before bedtime. This allows your body to process excess fluid before sleep, reducing nighttime urination. Many men report a 50% reduction in nighttime bathroom trips by the second night. Day 3 focuses on prostate decompression. Continue the morning routine, then consume 8 ounces of water every hour until 5 p.m., then stop. This creates a gradual pressure reduction in your pelvic region throughout the evening, allowing the prostate to release retained fluid. Throughout all 3 days, maintain room temperature water, never cold. Cold water causes blood vessels to constrict, reducing circulation to the pelvic region and limiting the protocol's effectiveness. Room temperature water enhances circulation and fluid exchange in prostate tissue. By the end of day 3, most men experience a noticeable reduction in prostate swelling, improved urinary flow, and reduced nighttime urination. These improvements continue to enhance if you maintain proper hydration, using the maintenance protocol I'll describe later. Despite water's simplicity, most men are consuming it in ways that actually worsen prostate inflammation and enlargement. Understanding these mistakes is crucial for implementing the protocol correctly. The first and most common mistake is bulk loading, consuming large amounts of water at once followed by long periods without any. Many men drink nothing all morning, then consume 20 to 30 ounces in the afternoon, followed by more in the evening. This erratic pattern creates dramatic fluctuations in ADH levels, causing your kidneys to rapidly shift between water retention and release. These fluctuations create pressure changes that stress your bladder, prostate, and urethral tissues. The second major error is drinking primarily cold or ice water. Cold liquids cause vasoconstriction, narrowing of blood vessels, which reduces circulation to your pelvic region by up to 22% for up to 40 minutes after consumption. This impaired circulation limits oxygen delivery to the prostate and slows the removal of inflammatory compounds. Room temperature water, by contrast, supports optimal circulation to pelvic tissues. The third mistake is consuming most liquids in the evening. Many men drink little during the day, then catch up at dinner and before bed. This creates maximum fluid pressure in your bladder precisely when you're trying to sleep, leading to nighttime urination and sleep disruption. Furthermore, lying horizontal alters fluid distribution in your body, increasing pressure on the prostate compared to when you're upright. Perhaps most detrimental is the widespread misconception that reducing water intake will reduce urination frequency. Many men with prostate issues intentionally limit water consumption, believing it will help them avoid bathroom trips. This approach backfires dramatically. Dehydration concentrates urine, making it more irritating to the prostate and bladder, while also reducing the body's ability to clear inflammatory compounds from prostate tissue. Lastly, many men fail to adjust water intake based on environmental factors and activity levels. Coffee, alcohol, hot weather, air conditioning, and exercise all increase fluid requirements. Failing to compensate for these factors leads to chronic mild dehydration that gradually worsens prostate inflammation over time. By correcting these common hydration mistakes, you'll create the foundation for the 3-day protocol's remarkable effects. The timing of water consumption is perhaps the most critical aspect of this protocol. Strategic timing creates physiological responses that directly reduce prostate swelling and improve urinary function. The most powerful timing element is what I call the morning reset. Consuming 16 ounces of room temperature water immediately upon waking, before coffee or food, triggers a cascade of beneficial effects. First, it promptly ends the mild dehydration that naturally occurs during sleep. Second, it signals your kidneys to reduce ADH production, normalizing fluid balance. Third, it gently increases blood volume and pressure, enhancing circulation to all tissues, including the prostate. This morning, reset should be followed by consistent, timed water consumption throughout the day. Research shows that drinking smaller amounts, 4 to 8 ounces, at regular intervals maintains more stable kidney function and blood pressure than consuming larger amounts less frequently. This stability is critical for reducing prostate swelling, as it prevents the pressure fluctuations that stress urinary tissues. Mid-afternoon timing is another crucial element. Between 2 and 4 p.m., your body's natural circadian rhythms cause slight drops in blood pressure and metabolic rate. During this period, increasing water intake to 8 ounces per hour helps maintain optimal circulation to the prostate region, preventing the afternoon fluid retention that many men experience. Perhaps most significant is the evening cutoff. Stopping water consumption 3 hours before bedtime allows your body to process and eliminate excess fluid before sleep. This dramatically reduces nighttime urination while still maintaining proper hydration. Studies show that men who implement this evening cutoff experience up to 60% fewer nighttime bathroom trips within just 3 days. For men with significant prostate enlargement, an additional timing technique called double morning hydration can accelerate results. This involves consuming the initial 16 ounces upon waking, then another 12 ounces 30 minutes later. This creates a gentle diuretic effect that helps flush accumulated fluid from prostate tissue early in the day, providing relief that continues throughout the day. What makes these timing strategies so powerful is how they work with your body's natural rhythms rather than against them, creating significant improvements without side effects or complications. Before I reveal the specific minerals that enhance this water protocol, I want to share something crucial for men looking for even faster prostate relief. While this water method works remarkably well on its own, I've identified 2 specialized supplements that work synergistically with proper hydration to accelerate prostate shrinkage and improve urinary function. These supplements contain unique plant compounds that reduce prostate inflammation and support healthy prostate tissue. When combined with the water protocol, men often experience relief in just 24 hours instead of 3 days. You'll find the exact products I recommend to my patients in the comments section below. These are the same formulations that have helped thousands of men avoid prostate medications and procedures. If you feel like you need some extra support, you can easily check out the pinned comment links. While proper water consumption alone creates significant improvements in prostate health, adding specific minerals can enhance these effects dramatically. These minerals work synergistically with water to reduce inflammation, support proper cellular function, and accelerate fluid balance normalization. The first critical mineral is magnesium, particularly magnesium citrate, or glycinate. Magnesium plays an essential role in muscle relaxation throughout the body, including the smooth muscle surrounding the prostate and bladder neck. Research shows that 78% of men with prostate enlargement have suboptimal magnesium levels. Adding 1/8 teaspoon, approximately 200 milligrams, of magnesium citrate to your morning water can reduce urethral compression and improve flow by relaxing these muscles. Potassium is the second vital mineral for prostate health. This electrolyte helps regulate fluid balance throughout the body and supports proper nerve signaling to the bladder and urethral muscles. Modern diets are often deficient in potassium, creating imbalances that contribute to prostate swelling. Adding a pinch of potassium chloride, sometimes sold as salt substitute, to your water helps restore proper balance and enhance the body's ability to remove excess fluid from prostate tissue. Zinc is perhaps the most prostate-specific mineral. The prostate contains more zinc than any other organ in the male body, using it for everything from hormone processing to immune function. Studies show that men with enlarged prostates typically have lower zinc levels in their prostate tissue than men with normal prostates. While zinc isn't typically added directly to water, taking a 5 to 10 milligram zinc supplement with your morning water can enhance the protocol's effectiveness. Trace minerals, including selenium, boron, and silicon, play supporting roles in reducing inflammation and supporting tissue repair. Rather than supplementing these individually, adding a small pinch of high-quality sea salt, approximately 1/8 teaspoon, to your water provides a broad spectrum of these minerals in naturally occurring proportions. For enhanced effects, some men benefit from adding 1 tablespoon of raw, unfiltered apple cider vinegar to their morning water. The acetic acid in apple cider vinegar helps optimize urinary pH, reducing irritation to the prostate and bladder. Additionally, it supports healthy gut bacteria, which play a surprising role in modulating systemic inflammation that can affect prostate tissue. The combination of properly timed water consumption with these strategic mineral additions creates a synergistic effect that can reduce prostate swelling more rapidly and completely than either approach alone. While reducing prostate swelling is the primary goal of this protocol, men consistently report additional benefits that significantly improve their quality of life. These side benefits often become as valuable as the prostate relief itself. The most immediate additional benefit is improved urinary flow. Even before the prostate physically reduces in size, proper hydration optimizes the composition of urine, reducing irritation to the urethral lining. This decreased irritation relaxes the sphincter muscles, allowing for stronger flow almost immediately. Many men report noticeably improved stream strength by the evening of day 1, well before significant changes in prostate size occur. Sleep quality improves dramatically for most men following this protocol. Beyond the obvious benefit of fewer nighttime bathroom trips, the normalized fluid balance reduces pressure sensations that often disturb sleep even when not urinating. Additionally, proper hydration and mineral balance optimize the production of melatonin and other sleep-regulating neurotransmitters. Men typically report falling asleep more quickly and experiencing deeper, more restorative sleep by the second night. Energy levels and cognitive function show remarkable improvement. Chronic mild dehydration, common in men with prostate issues, reduces brain tissue hydration, impairing concentration and mental clarity. The consistent hydration established by this protocol restores optimal cognitive function, with many men reporting a mental fog lifting that they hadn't even recognized was present. Perhaps most surprising is the improvement in erectile function that many men experience. The same blood vessels that supply the prostate also provide blood flow to erectile tissue. By enhancing circulation throughout the pelvic region, this protocol often improves erectile firmness and responsiveness as a secondary benefit. This improvement typically begins after 5 to 7 days of consistent, proper hydration. Digestive function also improves significantly. Proper hydration enhances the production of digestive enzymes and supports healthy gut motility. Men with prostate issues often have concurrent mild digestive complaints that resolve with this protocol, including reduced bloating and more regular bowel movements. Finally, many men report improved mood and reduced anxiety. Dehydration increases cortisol, the stress hormone, creating a persistent low-grade stress response. By maintaining optimal hydration, this protocol helps normalize cortisol levels, reducing irritability and anxiety while improving overall emotional well-being. These comprehensive benefits demonstrate how this simple water protocol affects multiple systems throughout the body, creating improvements far beyond just prostate size. While implementing proper water consumption is crucial, equally important is eliminating or reducing beverages that actively promote prostate inflammation and enlargement. These common drinks may be undermining your health each day without your awareness. The first and most problematic beverage is alcohol in any form. Alcohol acts as a powerful diuretic, increasing urine production while simultaneously dehydrating your tissues. This creates a double stress on the prostate: irritation from concentrated urine and reduced cellular hydration. Additionally, alcohol directly triggers inflammatory responses in prostate tissue. Studies show that men who consume more than 2 alcoholic drinks daily have prostate volumes averaging 23% larger than non-drinkers. Coffee and other caffeinated beverages create similar issues. Caffeine stimulates the bladder while acting as a mild diuretic. The combination increases urination frequency and urgency while potentially dehydrating the body if not balanced with additional water. Furthermore, the acids in coffee irritate the bladder lining, creating referred inflammation that can affect prostate tissue. For optimal results, limit coffee to 1 cup daily, consumed before noon, and follow each caffeinated beverage with 12 ounces of water. Sweetened beverages, including sodas, sports drinks, and commercial fruit juices, are particularly damaging to prostate health. The high sugar content triggers systemic inflammation, while artificial sweeteners, particularly aspartame, irritate the bladder and urinary tract. Studies demonstrate that men consuming more than 20 ounces of sweetened beverages daily have double the rate of progressive prostate enlargement compared to men who avoid these drinks. Less obvious but equally problematic are conventional milk and dairy-based drinks. Commercial dairy contains hormonal residues and inflammatory proteins that directly impact prostate tissue. Additionally, many men have unrecognized mild sensitivities to dairy proteins that increase overall inflammation. Removing dairy-based beverages often creates noticeable improvements in prostate symptoms within just a few days. Finally, highly acidic beverages, including certain fruit juices like cranberry and orange, can irritate the urinary tract and trigger inflammatory responses that affect the prostate. While these juices have other health benefits, men with prostate enlargement should consume them diluted with water and in limited quantities. During the intensive 3-day protocol, I recommend eliminating all these beverages completely for maximum results. After completing the protocol, you can gradually reintroduce some in moderation while observing their effects on your symptoms. Many men find that permanent reduction or elimination of these inflammatory beverages, combined with proper water consumption, maintains their improvements indefinitely. The true test of any protocol is the real-world results it produces. Over years of clinical practice, I've documented the transformations of hundreds of men who have implemented this water approach consistently. Their stories demonstrate how something as simple as properly consumed water can create life-changing improvements. Take Robert, a 68-year-old who had been on prostate medication for 7 years with deteriorating results. He was waking 5 to 6 times nightly despite medication, with a weak stream and constant pressure sensation. Within 3 days of implementing this protocol, his nighttime urination reduced to twice nightly. After 2 weeks, his symptoms improved so significantly that his urologist reduced his medication by half. Now, 8 months later, He's completely off medication with better urinary function than when he was taking the full dose. Then there's James, a 74-year-old who was scheduled for prostate reduction surgery after medications failed to adequately control his symptoms. Desperate to avoid surgery, he followed this protocol rigorously for 30 days before his scheduled procedure. At his pre-surgical evaluation, his urologist found that his prostate volume had decreased by nearly 20%, enough to significantly improve his symptoms. The surgery was canceled, and James continues to maintain his improvement through proper hydration alone. Michael's case demonstrates how this approach helps even younger men. At 52, he was experiencing early prostate enlargement with increasing urinary frequency and decreasing flow. Concerned about starting medication at such a young age, he implemented this protocol as a preventative measure. Within a week, his symptoms resolved completely. His most recent urological examination showed no progression of enlargement after 18 months, a period when most men his age with similar initial symptoms show measurable worsening. Perhaps most remarkable is George's experience. At 81, he had been through every available treatment, including 2 prostate reduction procedures that provided only temporary relief. Skeptical but desperate, he tried this water protocol. While it didn't completely resolve his advanced condition, it reduced his symptoms enough to significantly improve his quality of life, particularly his sleep, which had been severely disrupted for years. These cases illustrate an important pattern. The earlier you implement proper hydration, the better the results. However, improvement is possible at any age and any stage of prostate enlargement. The key factors in success are consistency, precision in following the protocol, and patience through the initial adjustment period. If you found this information valuable, take a moment to like this video and subscribe to the channel. The simple water protocol I've shared today could transform your prostate health and overall quality of life. Click right now on the video appearing on your screen and keep learning how to maintain firm erections, protect your prostate, and achieve more quality of life after 60.